All right, y'all. I think we're in week 7 with Gottman. I'm not sure. But you guys had a hefty reading for this week, the entire book. And my hope is that I will give you a good overview here that shouldn't replace reading because that's going to be able to give you a lot more in depth. So basically, what I'm going to be doing is going over all 10 of the principles from Gottman, and then also highlighting that last chapter around holding the hope. So, first principle, use research based methods to treat couples. So this sets the epistemological tone for the entire book. So the Gottmans, John and Julie, are not simply advocating for evidence-based practice as a buzzword. They're making an ethical argument. And as you know, they have a love lab. They do tons of biofeedback research with their methods. So couples come into us in high stakes relational distress, often with children, shared finances, and long-term psychological consequences hanging in the balance. From their perspective, it is not acceptable for couples therapy to rely primarily on intuition, tradition, or therapist preference. So at the doctoral level, I want you all to hear this as a claim about knowledge. Relationships follow observable, measurable patterns over time. If those patterns are predictable, then ignoring that data becomes a clinical liability, not a stylistic choice. Right? So, sticking with this first principle, one of the most radical contributions of the Gottman's work is not the interventions, it's prediction. So the Gottman's research did not simply explain why couples were unhappy after the fact. It predicted relationship dissolution years in advance, like at an 80% accuracy rate. This matters because most psychotherapy theories are explanatory rather than predictive. They help us make sense of what already happened. So Gottman flips that model. He asks, what observable processes reliably forecast relational failure or stability? So for clinicians, this raises a serious question. If we know certain interaction patterns dramatically increase the probability of relationship collapse, what is our responsibility when we see them in the room? Okay, so the sound relationship house we've seen, I'm sure y'all have seen it before. I did not provide a picture, so if you haven't, please Google it. It's not just a conceptual diagram, it's a structural theory of relational functioning. Each level reflects empirically supported relational processes rather than abstract personality traits. Importantly, the foundation is friendship, not conflict resolution. This challenges the field's historical obsession with problem solving. Gottman's data suggests that how couples relate outside of conflict predicts outcomes more strongly than how well they argue. So, at the doctoral level, I want you to notice how this theory quietly reframes pathology. Distress is not located inside individuals, but in deteriorated relationship structures. Okay, so they talk about the four horsemen, probably the most well-known aspect of Gottman, and most cited, and sometimes oversimplified. It's one of the most oversimplified elements of the Gottman model. So clinically, they are not bad behaviors to eliminate. They are markers of relational physiology and meaning. So contempt in particular is not just an affective stance. It is the single strongest predictor of relationship dissolution in the research. So we want to be asking, what conditions produce contempt and what systemic contexts maintain it? This moves us beyond technique into theory. The horsemen are symptoms of deeper relational erosion, not the disease itself. So similar to addiction. Because I know many of you come from a background with addiction treatment. So Gottman's work bridges psychotherapy and psychophysiology in a way that many relational models do not. Flooding reframes conflict escalation as a biological process rather than a moral failure. This has profound implications for how we time interventions. When partners are flooded, insight-oriented work is neurobiologically inaccessible. This raises a meta question. How often do our preferred theoretical interventions assume a nervous system state that the couple simply does not have access to? One of the quieter themes of this chapter is humility. Research-based methods protect us not only from ineffective intervention, but from ourselves, our biases, our countertransference, or our overconfidence. Gottman is explicit that therapists are poor judges of relational success when relying solely on subjective impressions. So, for clinicians, this challenges the romanticized image of clinical intuition as inherently superior. The question becomes, how do we integrate data without becoming rigid or mechanistic? That tension runs throughout the book. Okay, so to summarize principle one, Gottman is not arguing for cookbook therapy. He is arguing for accountable therapy. Research provides constraints. It tells you what is unlikely to work, what is dangerous, and what reliably predicts harm. Within those constraints, clinical artistry still matters. So, as clinicians, your task is not to choose between science and relational depth, but to hold them in productive tension. All right, so moving to the second principle. This principle, so to assess first, then decide on treatment, may be the most clinically corrective in the entire book. The Gottmans are explicitly critiquing a common therapist habit, defaulting to our preferred model before understanding the couple in front of us. So, at your level, this is about formulation discipline. Intervention without assessment is not efficiency, it is clinical guesswork. So the Gottmans are especially concerned about therapists who rush into skills training or emotional processing without assessing safety, violence, psychopathology, or power dynamics. So a key insight here is that misassessment causes harm. Couples therapy can escalate risk if the wrong model is applied to the wrong relational system. This principle reframes assessment not as bureaucratic intake work, but as a moral responsibility. So Gottman assessment is multi-method by design. No single data source is sufficient. Individual interviews protect against coercion and secrecy. Joint sessions reveal interactional patterns. Questionnaires provide normed comparison points. So notice how this mirrors mixed methods research design. Qualitative narratives plus quantitative measures produce a more reliable formulation. So this is one of the most ethically important sections of the book, talking about contraindications. So the Gottmans are clear, not all couples should be treated together. In particular, characterological violence is a contraindication, not because the relationship is too damaged, but because couples therapy can increase danger. So for clinician, this demands courage. Turning away from couples work is sometimes the most competent intervention. So the distinction between situational and characterological violence is central to Gottman's ethical framework. Situational violence emerges from escalated conflict and poor regulation. Characterological violence is about power and control. Treating these as equivalent is a serious clinical error. Assessment is what prevents that error. This is also where Gottman's work intersects with feminist and systemic critiques of couples therapy. Importantly, assessment does not end after intake. Gottman frames assessment as recursive, data continuously informing treatment decisions. This aligns well with doctoral level thinking about feedback informed treatment and adaptive intervention strategies. The question shifts from what model do I use to what does this couple need now? So, to summarize principle two, Gottman is advocating for restraint. Slowing down is not avoidance, it's precision. For advanced clinicians, this principle challenges us to tolerate uncertainty, complexity, and pressure without defaulting to familiar techniques. In many ways, this principle separates competent couples therapists from merely confident ones. All right, so principle 3. It marks a critical pivot in the book. After grounding us in research and assessment, Gottman now turns inward, not toward pathology, but toward subjective meaning. Inner world refers to how each partner experiences the relationship, their fears, longings, interpretations, and private narratives. So notice the epistemological shift. Research identifies patterns, but therapy requires access to lived meaning. Gottman is integrating empirical behavioral science with phenomenology. So love maps are not trivia exercises. They are maps of psychological territory. Couples who remain emotionally connected continue updating their knowledge of each other's internal lives. So this is attachment theory operationalized behaviorally. Emotional security is built through accurate, attuned knowing. When love maps deteriorate, misinterpretations multiply and conflict intensifies. Gottman's research shows that distressed couples interpret neutral behaviors negatively, a phenomenon called negative sentiment override. This is a cognitive emotional lens shift. We can understand this through attribution theory. When the relationship narrative becomes globally negative, every ambiguous action confirms that story. Therapy must address perception, not just communication skills. So, although Gottman is often categorized as behavioral, this chapter clearly integrates emotional depth. To understand a partner's inner world, the therapist must listen beneath defensive structure. So compare this with EFT's primary emotion focus. Gottman does not reject this emotional layer. He situates it within a broader relational structure. Gottman's data consistently show that emotional attunement buffers conflict. When partners feel understood, physiological arousal decreases and defensiveness softens. So empathy is not simply warmth, it is a regulatory intervention. The therapist models and scaffolds this attuned listening in session. So we want to push a little further here. Whose emotional world is typically centered? Whose distress is minimized? Gottman discusses influence and gender in later principles, but here we can begin examining power. Understanding inner worlds requires safety and equity. Without power balance, empathy becomes performative rather than transformative. So principle 3 deepens the work. We are no longer just interpreting behavior. We are no longer just interrupting behavior. We are reshaping perception. So this principle integrates cognitive, emotional, systemic, and physiological domains. Understanding the inner world transforms adversities into interpretable partners. All right, moving to principle 4, map your treatment route. So this is about intentionality. Gottman argues that couples therapy must follow a structured route rather than a reactive process driven by session-to-session crises. So this is a theory of change issue. How does movement occur? In what sequence? What precedes that? What precedes what? So the Sound Relationship House is not only a theory of relationship health, it is a roadmap for intervention. Gottman's treatment route moves from stabilizing destructive conflict towards strengthening friendship and meaning. So this is staged treatment. First, it's stabilization, then it's skill building, then it's deeper integration. One of Gottman's strongest claims is that emotional depth without safety can destabilize fragile couples. Therefore, conflict management skills are often introduced before deep exploration of dreams or trauma. So, this sequencing parallels trauma-informed care. You regulate before you process. Treatment mapping is individualized. A mildly distressed couple with strong friendship may enter a skill refinement, right? May enter at skill refinement. A couple with contempt and flooding requires stabilization first. So this is case formulation in action. The map is flexible but structured. Therapists often drift toward whatever argument is most emotionally charged that week. Gottman warns that without a treatment map, therapy becomes cyclical, revisiting the same arguments without systemic change. So, this is about meta process. Can you hold long term trajectory while containing short term volatility? Right? Mapping a treatment route does not mean rigidity. In fact, one of the defining features of advanced clinical competence is knowing when to pivot and why. Let's begin with escalation or regression. Suppose you've been building conflict management skills and the couple is making moderate gains. Then suddenly, escalation intensifies beyond prior levels. That regression is not random, it is data. It tells you something destabilizing has entered the system, perhaps externally, something like a job loss or parenting stress, or internally, maybe a fear of vulnerability increasing as intimacy deepens. This is where formulation becomes dynamic rather than static. You are not simply following a plan, you are testing hypotheses in real time. A pivot might mean temporarily restabilizing physiology, reinforcing regulation skills, or even stepping back into assessment mode. Now consider new disclosures. Infidelity, addiction relapse, concealed financial behavior, trauma history, or emerging domestic violence radically alter the treatment map. Gottman is clear that certain revelations change not only technique, but ethical posture. For example, discovery of characterological violence immediately suspends the couple's frame. This is not merely a shift in strategy, it is a shift in ethical responsibility. Continuing couples work in that context may escalate harm. Third, shifts in motivation. One partner may quietly move toward exit while the other intensifies effort. Ambivalence changes the treatment trajectory. In Gottman's framework, you must assess commitment explicitly rather than assume it. So, this is where discernment counseling logic intersects with Gottman sequencing. If motivation is asymmetrical, the route must account for that reality rather than bulldoze forward with skill training. The deeper principle here is responsiveness. Treatment mapping is not mechanical, it is recursive and feedback informed. Every pivot should be anchored in formulation rather than therapist anxiety or urgency. The advanced question I want to pose to you is when you pivot, are you doing so because the data demand it or because you are uncomfortable? This distinction defines expertise. So this slide addresses something that often creates tension for trainees. Gottman therapy is more directive than many relational models. The therapist interrupts, structures, coaches, assigns exercises, and actively shapes interaction. For clinicians trained in non-directive, insight-oriented, or postmodern models, this can feel intrusive. However, the directive stance is grounded in empirical findings about escalation and regulation. Gottman's research suggests that left to their own devices, distressed couples will rehearse destructive patterns rather than spontaneously repair them. Furthermore, structure is not authoritarian, it is protective, but directive does not mean dominant. The coaching role is collaborative. The therapist explains why interventions are sequenced as they are. They make the treatment map explicit. They invite consent for exercises and frame interruptions as safety measures, not corrections. I want you to notice the balance between epistemic authority and relational humility. The therapist holds research-based knowledge about patterns and outcomes, but does not claim to know everything about the couple's lived experience. Transparency is critical here. Gottman clinicians often narrate what they are doing. They may say things like, sorry, I'm getting snot in my nose. I'm going to slow this down because I'm noticing escalation. They might say, let's pause and identify the softer emotion underneath that frustration. They also might say, I'd like to try an exercise that research shows helps reduce flooding. So this meta communication prevents the directive stance from becoming opaque or paternalistic. Shared goals are equally essential. The therapist continually reconnects interventions to what the couple wants: more closeness, less volatility, and a better parenting climate. This keeps authority tethered to the couple's values. The deeper question is about power. All therapy involves power asymmetry. Gottman's model makes the power visible by structuring sessions. The ethical task is to wield structure in service of relational safety rather than therapist ego. There is also a countertransference dimension. Directive work requires emotional steadiness. If you are dysregulated, directive interventions can become controlling or reactive. So I would challenge you to consider: can you hold authority without rigidity? Can you offer structure without collapsing collaboration? This integration, authority plus attunement, is what distinguishes advanced couples therapists. All right, so let's slow down here because this slide looks simple, but these 3 bullet points are actually organizing principles for advanced clinical reasoning. First, treatment requires structure. Structure is not the opposite of flexibility, it is what makes flexibility possible. Without structure, couples therapy becomes reactive. The session follows whichever partner is most emotionally activated, whichever conflict is most recent, or whichever grievance is most rehearsed. Gottman's argument is that structure protects both therapist and couple from reenacting the very patterns that brought them into therapy. Think about this in terms of systems. A distressed couple's interactional pattern is self-organizing and self-reinforcing. If therapy lacks structure, the system will pull the session back into its default equilibrium, which is often hostility, withdrawal, or polarization. Structure interrupts being automatic. Now, the second point, sequence shapes outcome. This is a theory of change statement. Gottman is very clear that you cannot build shared meaning in a relationship that is physiologically unsafe. You cannot foster vulnerability when contempt is active. You cannot explore dreams within conflict if partners cannot tolerate 10 minutes of calm dialogue. Sequence matters because the nervous system matters. This intersects with trauma-informed care, polyvagal-informed interventions, and attachment sequencing models. Regulation, then safety, then empathy, then depth. If you reverse the order, you may destabilize rather than heal. This is one of the most common advanced clinician errors: going too deep too soon because we're comfortable with depth. And then the final point, the map prevents stagnation. Many couples therapy cases stall not because the therapist lacks empathy, but because there is no articulated trajectory. Sessions become iterative rather than progressive. The couple revisits the same arguments week after week with marginal variation. The treatment map serves as a developmental arc. It allows you to ask, where are we in the house? What level have we strengthened? What is the next structural task? So this is longitudinal thinking. You are not just managing a session, you are designing a process. It also protects against therapist burnout. When therapy lacks direction, clinicians experience helplessness. A map restores a sense of movement and coherence. Now, I want to push this one step further. A treatment map is not only for the couple, it's for you. It organizes your cognitive load. It helps you filter which conflicts require intervention and which are manifestations of deeper structural deficits. Without a map, every argument feels urgent. With a map, you can discern which moments are signal and which are noise. I want you to hold this tension. Structure without attunement becomes rigid. Attunement without structure becomes chaotic. So Gottman's principle 4 asks you to integrate both. The question I would leave you with is, when a couple leaves your office, do you know where you are headed next and why? If the answer is unclear, the map needs refinement. All right, so moving to principle 5. This principle shifts the focus away from the couple and squarely onto the therapist. The Gottmans acknowledge that many clinical texts do not maintain this focus. Couples therapy is physiologically activating for the therapist. When two people escalate in front of you, when they criticize, stonewall, attack, your nervous system reacts. Heart rates increase, muscles tighten, and cognitive flexibility narrows. So we must understand this through interpersonal neurobiology. You are part of the regulatory system in the room. Your physiology does not stand outside the interaction, it participates in it. If you intervene from a dysregulated state, you are not neutral, you are reactive. So Gottman extends the concept of flooding beyond partners to therapists themselves. Therapist flooding may manifest as an urgent desire to rescue one partner, an irritation toward a defensive or contemptuous client, an impulse to silence escalation quickly, or a desire to withdraw or dissociate internally. So, this is a countertransference literacy issue. Your internal responses are data, but they are not instructions. Without awareness, therapist flooding leads to premature advice giving, moralizing, or siding. When physiologically aroused, your executive functioning decreases. Your capacity for complex formulation narrows. If you intervene while dysregulated, you are more likely to overdirect, become rigid, align unconsciously with a calmer partner, and miss subtle repair attempts. So, this principle demands that you treat your nervous system as clinical equipment. Just as surgeons stabilize their hands before cutting, couples therapists must stabilize their physiology before intervening. Gottman suggests practical regulation tools: slowly breathing, softening posture, pausing before speaking. These are not wellness tips, they're clinical tools. So we can frame this through polyvagal theory. Your regulated state can co regulate the couple. Calm is contagious, just as escalation is. The therapist's nervous system becomes a stabilizing third presence. So, reactive interventions often feel powerful in the moment, but undermine long term alliance. So, for example, if you say something like, you need to stop attacking him, or that's not helpful, or let's move on, these statements may stop noise, but they do not increase understanding. This principle is about tolerating intensity without collapsing into control. Sometimes the most skillful intervention is a pause. So you want to ask yourself, am I uncomfortable with anger? Do I identify more with one attachment style? Does one partner remind me of someone from my own history? Gottman does not frame this as deep psychoanalysis for the therapist, but the implication is clear. Self-awareness is protective. So therapist of the therapist or self of the therapist work is not optional in couples therapy. All right, so principle 5 reframes therapist regulation as ethical obligation. If you escalate, the couple escalates further. If you become rigid, the couple polarizes. If you withdraw, the couple feels abandoned. Your regulated presence creates the conditions for safe structure. So this principle integrates systems theory, the fact that you are part of the system, attachment theory, that you function as a temporary secure base, and neurobiology, that regulation is co-constructed. The intervention does not begin with what you say, it begins with the state from which you speak. All right, principle 6. This principle moves the model beyond skills into structured emotional repair. Up to this point, Gottman has emphasized assessment, structure, regulation, and conflict management. Principle 6 marks a shift. Now we address the emotional residue that fuels current gridlock. Past regrettable incidents are not necessarily catastrophic betrayals. They may be harsh words during escalation, moments of abandonment, dismissed vulnerability, or failures to respond to bids. So this chapter intersects with trauma theory, attachment rupture, and memory reconsolidation. Unprocessed relational injuries do not disappear, they reorganize the narrative lens through which partners interpret each other. Gottman's research suggests that unresolved past injuries intensify negative sentiment override. When an old wound remains unprocessed, every current conflict reactivates it. So we can conceptualize this as implicit memory activation. The body remembers betrayal or abandonment even when the mind tries to move on. When processing, partners are not arguing about the present, they are relitigating the past. Many couples attempt premature forgiveness. They say it's in the past or we've moved on, but avoidance does not equal healing. This is experiential avoidance in relational form. Suppression leads to physiological reactivation and emotional volatility. Gottman insists that injuries must be processed explicitly and collaboratively. Gottman offers a structured, stepwise model for processing regrettable incidents. The structure matters. Without containment, revisiting injuries can escalate into renewed attack. The steps involve the injured partner describing the incident without attack, the offending partner listening without defensiveness, emotional validation of impact, taking responsibility for contribution, and then a collaborative meaning making. Notice the sequencing again: regulation, narrative, empathy, accountability, integration. A critical nuance here: taking responsibility is not the same as self-condemnation. When partners collapse into shame, defensiveness resurges. Gottman's model distinguishes between I am bad, which is shame, and I did something hurtful, which is responsibility. Oh, excuse me. This aligns with differentiation theory, the ability to hold imperfection without fragmentation. Emotional validation is central to this process. The offending partner must hear the emotional impact without rebuttal, correction, or justification. This requires ego strength. Without sufficient differentiation, like from the concept of Bowen, partners reflexively defend rather than empathize. Validation does not mean agreement with interpretation. It means acknowledging pain as real. The final stage of processing is meaning reconstruction. This is where the injury becomes integrated into the relationship narrative rather than remaining a live wound. This parallels narrative therapy and trauma integration frameworks. The couple moves from "this proves you are unsafe" to "this was painful and we have grown through understanding it." Without meaning reconstruction, apologies remain superficial. Principle 6 emphasizes that stability is not achieved by avoiding pain, it is achieved by metabolizing it. This chapter integrates attachment rupture repair cycles, neurobiological memory reconsolidation, accountability and differentiation, and processing regrettable incidents transforms injury into intimacy. This is not conflict elimination, it is relational maturation. The deeper clinical question is, can the couple tolerate staying in contact long enough to process pain without escalating? If not, earlier principles must be reinforced. All right, so principle 7. This operationalizes earlier research on the horsemen, flooding, and repair attempts into structured behavioral replacement. This is about behavioral substitution, regulatory sequencing, and relational microprocess. This principle translates prediction into intervention. Earlier, Gottman identified the four horsemen as reliable predictors of relational decline. Here, the focus shifts to replacement. Importantly, Gottman does not say eliminate negativity. He says replace destructive patterns with functionally adaptive alternatives. This is behavioral substitution theory. You cannot simply extinguish entrenched patterns. You must provide viable alternatives that regulate physiology and preserve dignity. So criticism attacks character. A gentle startup addresses behavior. The distinction is subtle but powerful. So you would compare something like, "You're so selfish," versus, I felt overwhelmed when the dishes weren't done. I need help. Doctorally, this is attribution restructuring. Gentle startup reframes conflict from global indictment to specific interaction. Research shows the first 3 minutes of a conflict discussion heavily predict its trajectory. This makes startup sequence disproportionately influential. Contempt is the most toxic of the horsemen because it signals moral superiority. Gottman's antidote to this is not simply stop being contemptuous, but actively cultivate appreciation and fondness. This connects to sentiment override theory. Positive sentiment must outweigh negative sentiment for stability. Appreciation is not cosmetic, it alters cognitive bias and physiological tone within the relationship. Defensiveness escalates conflict because it blocks acknowledgement. Gottman suggests that even minimal responsibility taking can interrupt escalation. So, for example, you're right, I did forget. This is ego strength in action. Responsibility without collapse requires differentiation. When partners can admit contribution without dissolving into shame, conflict remains collaborative rather than adversarial. Stonewalling is not indifference, it is often physiological overwhelm. Gottman's replacement strategy is structured self-soothing with explicit return. This aligns with affect regulation theory. When heart rate exceeds flooding, when heart rate exceeds flooding threshold, cognitive process decreases dramatically. Timeouts are not avoidance if paired with intentional re-engagement. So, a critical nuance. Gottman is not asking couples to suppress anger or disagreement. The intervention targets process, not emotion. This parallels acceptance based models. Emotion is allowed, destructive delivery is not. Replacement strategies allow emotional intensity without relational injury. This principle requires active therapist engagement. You must be willing to interrupt criticism and say, can you try that again as a complaint? Or, I'm hearing defensiveness. Can we slow down and take partial responsibility? This is process authority. It requires confidence and calm regulation, which is principle 5. Okay, so principle 7 operationalizes Gottman's predictive research into teachable alternatives. This chapter integrates behavioral therapy, skill acquisition, cognitive reframing through attribution shifts, attachment theory through safety enabling vulnerability, and neurobiology, again, regulation precedes insight. Replacing the horseman does not eliminate difference, it makes difference survivable. The deeper question for you as clinicians is, are you comfortable interrupting destructive patterns in real time? If not, the horseman will dominate the session. So, principle 8, strengthen friendship and intimacy, moves us from conflict management into the deeper stabilizing architecture of the relationship. This chapter is not about attachment security. I'm sorry, this chapter is. This chapter is about attachment security, sentiment override, and the everyday microprocesses that determine long-term resilience. Gottman's research repeatedly demonstrates that friendship, not conflict resolution, is the foundation of relational stability. Couples who maintain strong friendship systems weather conflict more effectively because their baseline sentiment remains positive. This is attachment security operationalized behaviorally. A secure base in adult relationships is built not through grand gestures, but through consistent, attuned micro interactions. Right? The friendship system includes knowing each other's inner world or love maps, expressing fondness and admiration, and responding to bids for connection. These are not superficial exercises. They are mechanisms that shift cognitive bias. When friendship erodes, negative sentiment override increases. When friendship strengthens, positive sentiment override emerges. A bid is any attempt for connection, a comment, a sigh, a question, a joke. Gottman's research shows that stable couples turn toward bids far more frequently than distressed couples. This is attachment behavior in real time. Each bid is a small test of availability. Repeated turning away does not just disappoint, it reorganizes the attachment narrative. Gottman identified that stable couples maintain roughly a 5-to-1 ratio of positive to negative interactions during conflict. This does not mean artificial positivity, it means relational goodwill. The 5-to-1 ratio reflects the broader concept of sentiment override. When positivity dominates, partners interpret ambiguous behaviors generously. Without sufficient positive affect, even neutral exchanges become threatening. Intimacy is not simply sexual closeness, it includes shared meaning, rituals of connection, physical affection, and emotional responsiveness. This chapter invites a broader understanding of relational health. Conflict work alone cannot sustain intimacy. If therapy becomes exclusively problem focused, friendship erodes further. Gottman often asks couples to recount how they met and what they admired early on. This is not nostalgia, it's cognitive restructuring. This resembles narrative therapy techniques. Reauthoring the relationship story shifts present perception. Admiration acts as an antidote to contempt. As therapists, we must actively scaffold friendship. This includes assigning daily check ins, reinforcing small positive interactions, and not allowing sessions to remain exclusively conflict driven. This requires resisting the pull toward drama. Growth is often quieter than rupture. All right, so Principle 8 reminds us that couples therapy is not only about reducing harm, it is about building resilience. This principle integrates attachment theory about secure base behavior, cognitive bias theory about sentiment override, behavioral reinforcement about positive interaction frequency, and systems theory, these micro processes that shape macro stability. Conflict management keeps couples from falling apart. Friendship gives them a reason to stay connected. An advanced clinical question becomes, are you spending as much time building strength as you are managing weakness? If not, the relationship may stabilize but never thrive. All right, this is one of the most clinically demanding chapters in the book. It directly addresses therapist countertransference, cultural morality, betrayal trauma, and neutrality in high intensity relational rupture. Affairs are amongst the most destabilizing events in intimate relationships for couples and for therapists. Gottman argues that moral judgment from the therapist, even subtle implicit judgment, can derail treatment. This principle demands deep countertransference awareness. Affairs activate cultural, personal, religious, and ethical frameworks within us. If those frameworks dominate the session, we stop treating the relationship and begin adjudicating morality. If the therapist implicitly sides with the betrayed partner, the unfaithful partner becomes defensive and withdrawn. If the therapist minimizes the betrayal, the injured partner feels invalidated. Gottman emphasizes that the therapist must hold both realities simultaneously. Betrayal is profoundly painful, and moral condemnation is not therapeutic intervention. This is about the dialectical holding, validating injury without weaponizing it. Gottman does not frame affairs as simple character flaws. While personal responsibility remains central, affairs often emerge with relational vulnerability, emotional disconnection, unmet needs, opportunity, and avoidance of conflict. This is systemic analysis without excuse making. Understanding context is not the same as absolving responsibility. Gottman proposes a structured pathway for affair recovery. A tone, so the unfaithful partner takes responsibility, expresses remorse, and answers questions honestly. A tune, the couple rebuilds emotional connection. And attach, the couple strengthens beyond pre-affair levels. This sequence mirrors trauma repair models: acknowledgement, then emotional processing, then relational integration. The atonement phase requires full responsibility taking. The unfaithful partner must tolerate repeated processing of pain without shutting down. This demands high differentiation. Without ego strength, shame leads to defensiveness and derailment. The therapist neutrality here allows responsibility without humiliation. So, attuning parallels principle 6, processing regrettable incidences, but often at higher intensity. The betrayed partner must narrate the injury. The unfaithful partner must validate impact without self protection. This resembles trauma processing with an attachment dyad. Trust is rebuilt not through promises, but through repeated emotional presence. The final phase moves beyond repair into growth. Gottman suggests that some couples report stronger attachment post recovery, not because the affair was beneficial, but because the repair process deepened vulnerability. This echoes post traumatic growth frameworks. However, this outcome depends entirely on authentic atonement and emotional processing. Principle 9 may be one of the most personally challenging for therapists. You must monitor your beliefs about fidelity, your own relational history, cultural and religious frameworks. So, Gottman is not advocating for moral relativism. He is advocating for therapeutic neutrality in service of repair. So, this principle integrates countertransference awareness, attachment rupture repair theory, trauma processing models, and differentiation and accountability. The central question becomes, can you create a space where truth, remorse, and pain coexist without judgment contaminating the process? That capacity often determines whether a fair recovery is possible. All right, so the final principle moves beyond stabilization and repair into existential integration. This chapter is about identity, ritual, culture, legacy, and the co-construction of relational narrative. Up to this point, Gottman has helped couples stabilize conflict, regulate physiology, process injury, and rebuild trust. So, Principle 10 asks a deeper question: what makes a relationship worth sustaining? Conflict management prevents deterioration, and shared meaning creates vitality. This is existential systems work. A couple is not just two individuals negotiating logistics, it is a microculture with rituals, values, and identity. Gottman conceptualizes long term couples as cultural units. So they develop rituals, things like holidays, daily routines, bedtime practices, shared values, things like parenting philosophy, spirituality, and work ethic, and role definitions, so division of labor, emotional labor. This parallels family systems theory and anthropological models of culture. When couples lack shared meaning, conflict becomes about identity rather than logistics. Many perpetual conflicts mask deeper dreams. For example, a fight about finances may reflect a dream of security. A fight about travel may reflect a dream of adventure. A fight about parenting may reflect identity or legacy needs. So, this chapter connects back to earlier principles. Conflict management makes it possible to explore dreams safely. Without regulation, dreams remain weaponized rather than understood. Gottman provides structured dialogue exercises to uncover dreams. The emphasis is not on an agreement, but on understanding the symbolic meaning beneath positions. This resembles narrative therapy and emotionally focused dialogue structures, as well as imago intentional dialogue. The therapist must protect vulnerability from attack. Rituals anchor meaning. These may include weekly date nights, morning check ins, spiritual practices, and parenting traditions. Rituals create predictability and reinforce attachment security. They serve as stabilizing structures during stress. Shared meaning does not require identical values. It requires mutual respect and negotiated integration. This intersects with differentiation theory, the ability to maintain individuality while co-constructing shared identity. Couples who lack differentiation either polarize or collapse into fusion. Both undermine authentic meaning making. Gottman's research suggests that couples with strong shared meaning weather external stress more effectively. Meaning strengthens commitment because it ties the relationship to identity and legacy. This aligns with existential psychology. Humans endure difficulty when they experience purpose. So, Principle 10 completes the arc of the book. The progression has been deliberate. First, use research based methods, assess before intervening, understand inner worlds, map the route, regulate yourself, process injuries, replace destructive conflict patterns, strengthen the friendship, suspend judgment during betrayal, and create shared meaning. This is a developmental model of relationship repair. Conflict management stabilizes the structure. Friendship enriches the emotional climate. Meaning solidifies long term identity. So, the final question I pose to you is: are you helping couples simply survive each other, or are you helping them construct something larger than themselves? Shared meaning is what this shared meaning is what makes long term attachment sustainable. All right, so chapter 11, Holding the Hope. This chapter shifts from intervention strategy to therapist stance. It is less about technique and more about presence, expectation, and emotional leadership in the room. This is about therapeutic authority, attachment positioning, differentiation, and moral courage. Hold the hope is not sentimental language. Gottman is not suggesting blind optimism. He is arguing that couples in severe distress often lose the ability to imagine repair. In those moments, the therapist temporarily holds a vision of possibility that the couple cannot access. This aligns with attachment theory. In highly distressed dyads, the therapist functions as a provisional secure base, not for one partner, but for the relationship itself. Hope here is structured confidence grounded in evidence and process. Gottman notes that couples often enter therapy after years of deterioration. They may present with flat affect, cynicism, exhaustion, and resignation. This resembles relational learned helplessness. When repeated repair attempts fail, couples begin to believe change is impossible. At this stage, therapist's stance becomes critical. Holding hope requires internal regulation and conviction. You must believe in the treatment sequence, the possibility of restructuring patterns, and the power of small shifts over time. This is epistemic authority grounded in research rather than personality charisma. If the therapist subtly communicates doubt, the couple often amplifies that doubt. Holding hope does not mean insisting that every relationship survive. Gottman is clear that some relationships may end, particularly in cases of chronic violence, unwillingness to accept responsibility, or persistent contempt. Hope must be differentiated from outcome attachment. You hold hope for growth, clarity, and integrity, not necessarily for continuation at all costs. Couples therapy often becomes emotionally intense when partners despair or escalate, the therapist must remain steady. This reflects differentiation theory, the ability to maintain clear thinking and emotional regulation under relational stress. Emotional leadership means not collapsing into urgency, cynicism, or saviorism. Holding hope is an ethical stance. It means believing change is possible, being honest when partners are destructive, and respecting the couple's autonomy in deciding their future. This chapter synthesizes the entire book. Research gives you confidence, structure gives you direction, regulation gives you steadiness, and hope gives you endurance. So, Hold the Hope is ultimately about therapist maturity. Couples often borrow your confidence before they develop their own. This chapter integrates attachment theory, so secure base function, systems theory, the therapist as a regulatory node, differentiation theory of self regulation under stress, research based conviction, and predictability of change when structures applied. So a final question becomes, can you remain steady, evidence grounded, and hopeful even when the couple cannot? So this is the final principle.